Emerging research has shown that the older we become and the younger we actually are, the more we become at risk of a range of issues. Adults around the age of 35 are encouraged to take up regular health screening. Now, in a world where other matters become priority and health is put in the back burner, poor eating habits, excessive drinking, and unattended mental challenges take over, leading to unhealthy and overworked adults who become prone to risks ordinarily associated with old age. So let's discuss this and more now with sports and clinical psychologist Dr. Keitumetse Mashego. Good morning and welcome to Newzroom Afrika.
Good morning and thank you for having me.
So doctor, what are the most common health risks that young adults around the age of 35 should be aware of?
Sadly, it's your lifestyle and stress-related, challenges and mental health disorders that are unattended. So typically things that impact your immune system, BP, heart attacks, strokes, diabetes, cholesterol, and all the, typical mental health challenges like substance abuse and anxiety and depression.
And what role does the stress and burnout play in the development of health issues in young adults? How can individuals prioritize self-care and mental well-being in a fast-paced work environment especially?
We need to understand that stress is physical symptoms without the physical cause, meaning a client will present with a headache and medical doctors will check, everything and anything, and they will not find the root cause of it. And it's usually because what's happening in their mind or, they need to really address underlying mental health challenges. So those two are very much interlinked, the mind and the body. And people often pay attention only to the body and rarely look at what's happening in the mind, and that's where you get the burnout and the stress. So burnout is people who often say things like, I have nothing left to give. They're emotionally and physically exhausted, and they just struggle, and it's often linked to depression. So, and we need to really promote people looking at what's happening within their mind so that they can prevent severe instances of burnout and other mental health disorders.
And doctor, how do poor eating habits and excessive drinking and unattended mental challenges contribute to health problems in young adults? And what are the long-term consequences if left unchecked?
So when people are not addressing the mental health challenges or underlying issues that they might have, this often leads to poor maladaptive coping strategies such as, the drinking and, abuse of substances. And substance is not just your hardcore drugs. It's often sometimes food. Sometimes people use that as a coping mechanism or attempt to cope with their stress. Sometimes it's also over-the-counter medication, whereby people are often just taking your headache tablet because they're not coping. And so we really need to understand that not addressing those things that you struggle with or the symptoms that you are presenting with often leads to chronic presentation of things whereby it's more than just depression. It can lead to things like your chronic substance abuse issues and also your anxiety and just a lot of severe pathology whereby long-term intervention is needed from a clinical psychologist or a psychiatrist.
All right. And what are the most significant risk factors contributing to the increasing prevalence of stroke in younger adults?
It's the things that we're eating, but also just not being able to have coping strategies. And sometimes people are taking things like your caffeinated drinks in an attempt to deal with stress, which is in the long run not good. And some people are predisposed, to having things like your stroke just because of their genetic wiring. So we really need to be aware that just because me and you are taking, your caffeinated drinks, one of us might struggle more than the other just because of our genetic predisposition. So many people are not aware of the history in their families of the disorders that they struggle with, both physical and mental. So I think understanding your family history is quite important, and doing the screens for the things you are at risk for, and also intentionally, creating a lifestyle for yourself that doesn't exacerbate that risk. So people are not often aware. We're just on autopilot and, doing what it is that we think is the norm in an attempt to cope with the stressful things that we have. And when we look at, our country, just as an example, I mean, there's so many things that are happening. This That we are a country that's constantly under stress, under pressure. We are a highly anxious nation because of the things that are happening in society. So we really need to be aware, self-aware of the things that will put us at risk for challenges in our life.
And what lifestyle changes can individuals make to reduce their risk of stroke? How effective are these changes in preventing stroke?
It's firstly just being aware of the things that you eat. You are what you eat, as the saying goes. So people need to be aware that, to minimize risk, we need to watch what you eat, and also just ensuring that you get rest. I think we often put on a pedestal people who work 24/7 or workaholics, or people who are constantly on the grind. So we really need to be sure that rest is a part of our lifestyle, and also just exercise as well. And when we talk about exercise, I mean, we don't mean that you must be in the gym 24/7. It's okay if you're doing 20 minutes 3 times a week, right? And also just having hobbies outside of work. I think most of us become defined by what we do at work, that when we are not at work, we feel so incomplete and lost. So it's quite important that we do the work to do the things that bring us joy, whether it's painting, learning an instrument, just that hobby that, makes you break away from the constant overthinking and overworking self.
And can you explain the concept of the stroke belt?
So what happens is there are people who are at risk, as I've indicated, for that. So for strokes, and we need to really understand that how it impacts you depends on, so many other things, depending on the physical condition and what it is that you're genetically, what predisposes you to get a stroke. And as I've indicated, there are many factors that play a role. Like, I think a medical practitioner or a nursing practitioner will be at best to give some of the factors, but they include things like your cholesterol level, and also your heart, EEGs must be done just to check where you are at in terms of your physical condition, which will put you at risk for that.
And you touched on mental health earlier. What are some common mental health challenges that young people face, and how can regular health screenings help identify these issues early on?
Unfortunately, we've got a substance problem, and as I've indicated, it's not just alcohol or just hardcore substances, but it's people just misuse food and also just the over-the-counter medication. So we do have, unfortunately, in South Africa, a substance abuse problem, and it's starting to impact also the people who are pre-teens as well, because alcohol is seen as a way to escape, is used as a way to escape things like the challenges that we have in South Africa, like your unemployment, etc. And also it's what we're seeing a lot is a lot of anxiety. People are struggling with a lot of anxiety issues, and there's a lot of depression and suicidal ideation. And there's also things like your PTSD due to the things that have happened in our lives which haven't been dealt with. And what people need to be aware that when you're not dealing with something, just because you're not acknowledging it, doesn't mean it is not impacting you, right? When you repress, suppress, it's there and it will come out. You will project it in some way or another. And I think that's what we, as mental health professionals, are always constantly, trying to put out the message out there that, we really need to prioritize the mind, because it's that powerful. It's so important.
Yeah. Doctor, what role do family and peer relationships play in shaping young adults' health behaviors and outcomes? And in closing, what advice do you have for young people out there?
So the young people are always constantly learning from what's happening in their environment, be it the immediate caregivers or people around them, the community, society at large. So we really need to be aware as the adults of the current generation that, you do have young people watching, and we really need to also conscientize the young adults that they can choose to be different, like they can develop different habits in spite of how they grew up. So you do find that, if a family, for example, has unhealthy eating habits, that, it is cascaded down into the newer and upcoming generations. So we really need to be aware that whatever it is that we are showing the young adults, that this is what they will learn. And in the same breath, to also say to the young adults that it's okay to choose different and to want to be different and to want to be a healthier version in spite of where you come from. But also we need to bear in mind that there is a lot of, unfortunately, poverty, and, there's a struggle. Healthy living sometimes can be a little bit pricey in terms of, trying to maintain a certain level. So we really need to understand that it's not always easy, but, we can develop coping strategies in spite of the situation we find ourselves in.
All right, Doctor, thank you so much for your time.
Thank you.